Good morning, everybody. My name is Dewey Case. I'm the Technical Director for CMAC. We want to welcome you to this installment of our webinar series. Just for everyone's awareness, this is being recorded and at a later date will be made available publicly through our CMAC YouTube channel. While we're talking about that, right, feel free to find us on CMAC or on the YouTube rather under CMAC where we have prior webinars that are posted. Also, make sure to find us and follow us on LinkedIn. We're very happy today to have Tom Fink with and Ashley Rominski with Cuyahoga County Board of Health in Ohio. Tom is one of our very valued board members, and Ashley is one of our newly adopted CMAC ambassadors with her efforts and promotion of the MAC. So we're very excited to have them on. They're health officials. They have a wealth of knowledge, and we're very excited to hear what they have to share with us today. A little housekeeping note, we're planning on about a 45 to 50-minute presentation with a Q&A at the end. If you have any questions, please put those in chat, and we'll address those once the presentation is over. With that being said, I'm going to turn over to Tom and Ashley.
All right, thanks, Dewey. Can everybody hear me? Cool. Okay. So just so like Dewey said, my name is Tom Fink. I am with the Cuyahoga County Board of Health. I am an REHS. I've been one for about 23 years now. So welcome everybody. I'm currently a supervisor here in our office. So Ashley, I'll let you introduce yourself as well.
Hi, everyone. I'm Ashley Rominski. I'm also a registered environmental health specialist in Ohio. I've been a registered environmental health specialist for almost 11 years, and I'm a supervisor here in our environmental health districts.
Right, so we're here to talk about fixing a problem pool, okay? From our perspective, so from a local public health perspective, how do we fix a pool that is giving us problems? Obviously, we can't go in and do the work ourselves, so how do we get these operators, these problem operators, to get their pools up to code and up to the standards that we're expecting? So a little bit about our pool program here in Cuyahoga County. Like Ashley and myself mentioned, we are located in Ohio, located in Northeast Ohio in the Cleveland area. Our county seat is the city of Cleveland. We're the public health department for 58 villages, cities, townships, that kind of stuff. So basically everything in Cuyahoga County except for the city of Cleveland, they have their own health department. And we encompass about 1.25 million people in the county overall. About 900,000 of those people are within our jurisdiction. And just so you guys know, we're going to go through this a little quickly. We did this presentation originally for the AOAP Association of Aquatic Professionals Conference back in February, where we had about an hour and 15 minutes. So we have quite a few slides in here, so we're going to kind of fly through this a little bit quickly through some of it. So if anyone has any questions, like Dewey mentioned, just please put your question into the chat. We'll be more than happy to get to those questions at the end. A little bit about the specific program here at the Cuyahoga County Board of Health in regards to the pools program. It's managed by a supervisor who was me, now is currently Ashley. We also have a pools program manager that runs underneath that. So the difference between the supervisor and the program manager, the supervisor oversees the people that actually are out there doing the inspections. So we manage the inspectors that are doing the work. The program manager manages the program. So they're in charge of the trainings, the rules updates, the licensing, all that kind of stuff. So work hand in hand together. It's not like one person does it on an island and the other person does the other thing on the island. We're working very closely together, but we do have that differentiation between those two roles. There's 11 full-time inspectors that we have doing pool inspections, soon to be 12. We're training one new one up right now. We have one part-time inspector, and then we have one administrative assistant that helps us out as well. So in 2024, we licensed just under 600 bodies of water. So those included about 360 outdoor pools, and the rest were all indoor pools. Now our pools are broken up into 3 different license categories. You have your pools, your special use pools, and your spas. Spas are pretty self-explanatory, your hot tubs. Difference between a pool and a special use pool is a special use pool has some sort of special feature, whether it's a zero depth entry, toys, or features that way. Just has some sort of special feature that would encourage individuals to use it in a different way than a standard rectangular competition pool. So here in the state of Ohio, our laws and rules are maintained by the state themselves. So Ohio Revised Code, which is the law, Chapter 3749, gives the Director of Health the authority to create the rules. and then also delegates that down to us at the local level to do the enforcement of the rules. So the rules are actually located in the Ohio Administrative Code, the OAC, Chapter 3701-31. And ours are pretty all-encompassing. The state of Ohio actually does a pretty good job making sure that everything is included inside those rules, inside our rules package. Covers everything from construction to operation, maintenance, safety. Almost everything that we could enforce in a pool is covered by our rules. That being said, the gold standard for rules obviously isn't ours, but it is the Model Aquatic Health Code. That is why we are all here, why we're all part of the CMAHC. We really do appreciate you as a board member, appreciate you guys helping out, whether it be as members, as ambassadors like Ashley, as either just individuals that are interested in the MAC and want to learn more about it. We do really appreciate all of your help, and we encourage you to get as involved as possible. As we all know, the MAC is the gold standard. It's used worldwide. It has been adopted in numerous places. Here in the state of Ohio, like I said, we haven't obviously adopted the MAC, but we do use it for all of our rule revisions. So if there is some sort of discrepancy in regards to conversations or something like that, or there's new and emerging technologies or bodies of water that we don't currently license, then we pull information directly from the MAC and put it into our code. One of the things that we did do that with was spray grounds or splash pads. We pulled the information and the code directly from the MAC and placed it directly into the Ohio code. So while we don't use the MAC directly, we like to be involved with it. And obviously, in our roles, we're pretty heavily involved with the MAC, just because, like I said, while it is the gold standard, we do like to use it here in Ohio to ensure that our codes are as up to date as possible.
So as Tom stated, we follow the rules from the Ohio Administrative Code. That requires us to do one inspection per licensing year and one equipment inventory inspection per calendar year. Although our policy here at CCBH requires us to do 2 standard inspections, and those inspections are conducted between June 1st and May 31st. And really the reason why we do a little bit more inspections than what we're required to, we want to get a better understanding of what is going on at our pools, seeing what problems that they're having. You might go out one time and there's a great inspection, or it's a horrible inspection, and maybe just the person in charge isn't available or isn't there, or they really just don't know the whole ins and outs of the operation. So we're able to help them a little better. Part of our inspection process, we also want to make sure that we're documenting our violations. And unfortunately for the state of Ohio, the health department does not have authority to close pools during the inspection. However, there are 12 critical violations in our code, and those critical violations say the licensee will not operate a public swimming pool, including but not limited to the following. So some of those items include disinfection, circulation, maybe there's a fecal diarrheal incident, electrical hazard. Could also be issues with the AAC, the automatic chemical controller, or safety vacuum release system. Go ahead to the next slide. And then this just kind of shows us of our top violations that we saw through our licensing year. So this was tracked from from June 1st all the way to January 10th. So in that time, there was 2,600 violations that were documented in our inspections. 470 of those were critical, and there were a little bit over 1,000 repeat violations. So you could see that we were able to look at the overall violations, our critical violations, and our repeat violations. We do newsletters annually to our operators, so we're really able to focus on the items that are occurring at our pools and spas to give them a better understanding maybe of information that is needed. Next slide. And here for our inspections, it's something that I think we take great pride on. We focus a lot on education. We feel it's very important to be able to work with our operators, try to answer any questions that we can. And if we don't have the answers, we have great resources. The CMAHC is a great resource that we can reach out to maybe get a better understanding to help them. So our inspections are education-based, and we also need to make sure that we're doing re-inspections to see improvement or corrections to see that they're working towards items. We're also offer pool trainings annually here at our office. So this week we have our certified pool operators course, which is a 2-day course. And then we have a basic pool operators course that we'll do next week. And unfortunately, if there's no improvement with our education, our re-inspections, we unfortunately have to move towards the enforcement. So this is just an example of our enforcement policy and procedures that we have. And our enforcement policy was originally developed in 2014, and it was to ensure that we were following the code of the Ohio Administrative Code. It standardizes the process, and it helps work with legal counsel to develop that. Our current version that we have is from February 9th of 2024, and this is used for facilities that are unresponsive to standard inspection practices. And I'd also like to note that we're audited by the State Health Department, so this is reviewed during our surveys. So they take a great deal of depth of looking at our enforcement procedures to make sure that we are following everything in our procedure, which is a great checks and balances. Next slide. So we have enforcement procedures, but what's in it? So we have the purpose, our principles, definitions, and the progressive enforcement procedures.
All right, so like Ashley mentioned, there's 4 sections in our enforcement policy. The first one is the purpose, and just like any good policy, we have to have some reason to have it. We don't want to just create a policy just to create a policy. Much to the contrary belief, government doesn't run that way. We do actually try to have some sort of purpose behind what we do. So the purpose of our enforcement policy, the first section, basically goes over the laws and rules that we're enforcing. Obviously, there's got to be some sort of backbone for what we're doing. So it identifies what we're doing. So we talked about the administrative code and the revised code a little bit earlier. So it just identifies those again for us so that it's in the policy and it's specifically there. Another thing it does is it provides consistency across all of our inspectors. That way, someone's not enforcing the rules a different way in one side of the county versus another. We want to try to be as consistent as possible across not only our county itself, but across inspectors and inspections. So it just allows us to provide that consistency for our operators as well. And then it provides guidelines for step-by-step instructions on how to run our enforcement policy and how to run our enforcement procedures. So again, it's just enforces that consistency across our inspectors and across our inspections by providing those step-by-step instructions.
So for our principles, it explains why is this policy necessary. So kind of like Tom said, we just don't want to make something up. So we think it's necessary because we want to make sure that we're standardizing the operating procedure for progressive discipline. So when all that education or outreach or follow-ups just is not working, then we unfortunately have to look at what it might be for the license suspension or revocation. And we want to make sure that we are following the framework. So that puts responsibilities on us as the licensure and also the licensee. We want to make sure that there's checks and balances there. And then of course, due process, making sure we're doing our follow-up inspections, and it really creates a course of action for continued non-compliance.
All right, so the third section in it is our definitions. Just like any good policy or code, we have to have definitions in there to define terms that are used throughout the document. So a couple we wanted to point out specifically for you guys that are in our policy as far as the definitions go are: one is immediate danger to public health. So these are those critical violations that Ashley mentioned earlier on in the presentation. So the stuff that could immediately lead to someone getting hurt, sick, injured, whatever it might be. But the one thing is, along with that we added to it was our perimeter barrier violations. Here in the state of Ohio, the perimeter barrier violations are not critical violations. So it's something that it's a non-critical. So it's not something that our code specifically states that an operation shall not operate with. So we wanted to try to make that a little bit more stringent. And because here in our jurisdiction inside Cuyahoga County, we feel that the perimeter barrier should be a critical violation. Obviously, you want to keep the people out of the pool that aren't supposed to be in there. And it's a huge safety assistant for you guys, for operators, to make sure that the perimeter barriers are intact and are working the way they should be. So we wanted to add that somewhere and try to get a little bit more teeth behind the violations that we write for our perimeter barriers. So we included that in our immediate danger to public health definition. Administrative hearing is another thing you're going to hear a little bit more about later on in the presentation. That's a little bit different than we call it also our informal hearing. So it's not a formal hearing in front of the board, stuff like that. So we just wanted to point that out to you guys a little bit. The other thing we wanted to pull out of the definitions in the Ohio Administrative Code and put in our policy just for clarification was what the definition of a private residential swimming pool is. Here in the state of Ohio, we don't do anything. We don't have any jurisdiction over private residential swimming pools. And in the code, it specifically states that a residential swimming pool is a pool that services up to 3 families. So anything that services more than 4 families would fall underneath the health department's jurisdiction. So that is everything from your HOAs to your hotels to your community pools. So if there are more than 4 families that can access, or 4 or more families, excuse me, that can access that body of water, that pool, then it does fall under our jurisdiction and will be licensed by us. So we wanted to pull that one out, put that into our policy for specification. That way there is no confusion in regards to whether or not we have any jurisdiction over this pool that we're trying to work on this enforcement policy or procedures. The other definitions we wanted to kind of point out to you guys and give you guys a little bit more information on are continuous non-critical and then our recurring critical and non-critical violations. One thing we were having issues with is those pools where you walk out there 4 or 5 straight inspections, you're writing up the exact same thing every time. We really had nothing to go on with that except for continuing to do re-inspections. And if the operator wasn't following up with it or wasn't basically just blowing us off, there wasn't much we could fall back on. So what we did was we added this continuous non-critical violation definition to our policy to give us a little bit more teeth to go out there, and if a violation shows up on 3 consecutive standard inspections, the non-critical violation, excuse me, shows up on 3 consecutive standard inspections, then we can now put them in the enforcement procedures and work with that operator on getting that corrected. The other thing that we wanted to make sure we encompassed with our procedures, with our policy, was the recurring violations. And by that, what I mean is those violations that are there, they fix it, but then it comes back. So you end up kind of going on that roller coaster ride where it's the pool is good, but then it goes bad, and then it gets good again, and then it gets bad, and then it gets good again. And we wanted to make sure, we want to try to keep all of our pools, all of our spas up toward as close to compliant to all of our codes as possible. So we wanted to try to capture those yo-yo facilities, those yo-yo operators, and try to capture them in this as well. So we added definitions for those 2, those recurring critical and non-critical violations too.
So for the progressive enforcement procedure, there's 5 steps, and we're going to focus on all 5 of these steps individually. So the first one would be your inspection, documenting your violations, doing your re-inspections, notifying the supervisor that the enforcement review is needed, and then actually starting the enforcement action. So for your inspection, like we mentioned before, you're required to go out there 2 times a year. So obviously you want to make sure that you're completing your inspection as you're supposed to do. Go ahead to the next slide. And then it's important not only to show up and do your inspection, but you also need to make sure that you're documenting your violations, because as we know, if you didn't document it, did it happen? And can you remember the next time that you go out? So it's extremely important to document your violations, and not only to document, but to provide details to help you to make sure that the operator understands what you're telling is an issue. And so it helps you come back later on to correct that as well. In our violations, you want to make sure that it's documenting as a repeat and a critical violation as we outlined in the definitions. So that helps us with our enforcement policy to see what is a reoccurring, what is a repeat, and a critical. And the most important thing of your inspection, not just doing the inspection, writing the violations, is obviously discussing the report with your operator. Can't just type up of a report and send it out to them. You should be going over with them, explaining to them, answering any questions that they may have, so that way you're able to get it corrected. Next slide, please. And then the next portion is doing a reinspection. So you want to do a reinspection to verify if those violations have been corrected. And for the most part, reinspections are dependent on the inspector's discretion. So if they feel this is a recurring issue or something that they think is very important, if it's a non-critical, that they can go back out. In our code, though, if there is a critical violation that cannot be corrected by the end of the inspection, you are required to go back out and follow on that. And one great thing with our follow-up inspections is that we can go out as many times as we deem necessary to have that corrected.
Okay, so our sanitarians, our inspectors are out there. They're doing everything that they can to get these operators up to compliance, and they're not working with them. It's to the point now where they need to do a little bit more in order to get these operators to be where they need to be. So we start moving them into the enforcement policy. So they've gone through all the re-inspections, they've gone through everything they need to do. Now it's time to go a little bit harder. So what happens? So the program manager then works with that sanitarian or that inspector to create an enforcement file. So what they're doing is they're creating or basically collecting all the inspection reports, any kind of complaint investigations or compliance investigations that they were on, any pictures that were taken, and then create a chronology. As you could tell, as we go through this presentation here a little bit more, you'll see that we rely very heavily on documentation. Like Ashley mentioned earlier, if we don't document it, it didn't happen. So we want to try to make sure that we're crossing all of our T's, dotting all of our I's as we go through this process. Make sure that if it does go any further down the line, that we have all of our ducks in a row and that it's going to continue to go on, and that we are going to get this operator or this facility where it needs to be. So you'll see that there's a lot of documentation that takes place from this point forward outside of the normal inspection reports and stuff like that. So after the chronology is created, the file is created, everything like that is done. The supervisor will then take it and review that file. What we're looking for as a supervisor staff is we're looking to see if it actually does warrant enforcement. So is it something where just a couple more re-inspections might take care of the issue, or should we go a little bit farther? So we're looking for those recurring critical and recurring critical violations or non-critical violations, and then those continuous non-critical violations. So it's stuff we talked about earlier in those definitions. We're looking to see if those inspections are actually notating that as well. And then everything is added into our facility file. So we have a electronic database or electronic inspection system that we use where we are able to maintain all of our information and all of our documents inside that one file. Like I said earlier, this whole process takes a long time, unfortunately, but we don't want to trip over any speed bumps as we go through it. So there is kind of a deliberate method to our madness with all of this. We want to make sure that if it does get to the end, that we have all of our ducks in a row and that it's not going to get thrown out on some type of technicality. So our file is pretty extensive inside of our system in regards to what we maintain in there. Like I said, whether it be old reports, pictures, chronologies, stuff like that. So we do try to do as much as we can and get everything ready for this next step. All right, so after the supervisor takes a look at it and reviews everything and verifies that everything is where it needs to be, we move on forward. So what happens next? So now comes the meat and potatoes of our procedure or our policy. We go into the actual enforcement action. So we're a couple different steps inside this. And again, we're going to talk about each one of these individually. So the first step is a warning letter that gets sent out to the operator. After that's that administrative hearing that we talked about a little bit earlier with the definitions. So this is your informal or administrative hearing. And then finally, that license suspension or revocation, where it's just this operator just hasn't followed up with what they need to do. And there's no other option on our end, but rather to suspend or revoke their license. So the warning letter, what goes in it? So basically what happens is, and again, this is the job of the program manager. The program manager handles this aspect of it. So they take all of the inspections that the operator or that the inspector has done or the sanitarian has done over a certain period of time, depending on how long the issues have been ongoing or recurring at this facility. We could go back a year, go back maybe 2 years, and then also depending on how many inspections have been done as well. We'll go back and we'll take a look at all those inspections and pull out all the violations that were written. So in this letter, we list each violation along with the appropriate section of code, because again, we do have it in our purpose and in our definitions of what code and rules we are enforcing. So we want to make sure that we're reiterating that. And then the big thing that it does is it establishes a reasonable correction time frame. So with each one of our inspections, our inspectors usually give them a week, 2 weeks to get this stuff taken care of. With this warning letter, it puts it more in writing that, hey, this stuff needs to be done by this point, or you're going to move on to the next step in our enforcement procedures. With that, the reasonable correction time frame varies based on the violation itself. Some of the violations might all fall underneath one blanket. Hey, within 2 weeks, get all this stuff taken care of. Others might need to be immediate. So some of those critical violations that Ashley was talking about earlier, your disinfection levels that maintained at a level below what's required, your circulation system not working, your automatic chemical controller not working, electrical hazards, stuff like that, we're going to have it corrected immediately upon receipt of this letter. Other stuff, deck signs not painted on correctly or fading, or other stuff like that, along with trying to think, signage might not be correct, stuff like that. We'll give them another week, maybe 2 weeks, to get this stuff all taken care of and get it corrected. But what happens after this is we usually send out, or we will send out, the inspector that normally hands that facility's inspections, along with either the program manager or one of the supervisors, myself or Ashley, will go out with that inspector, and we will verify whether or not these violations have been corrected. If they're not, we will move on to the next step. Now, 99% of the time, they usually do get corrected after this warning letter, but on occasion, it does happen where they don't. Warning letter just doesn't work, whether the operator doesn't get it because it goes to the maintenance guy, it doesn't end up getting to the operator itself, it goes somewhere to like a corporate location that's out of state, whatever it might be, or they just don't care and just didn't fix it. There are times that it does. But to try to limit the amount of times where the letter doesn't reach the correct person, when we do mail this letter out, we mail it out both standard and certified, and we mail it to the license holder. A lot of times what happens and what we find when we're doing our inspections, we're dealing with a maintenance guy that might turn over every couple months, or dealing with someone who is working in the pool, but also doing 16 other jobs, just like the majority of the people that we're dealing with on a regular basis, and the pool might not be their number one priority. So what we do is we mail this out to the actual license holder themselves, who might not be aware that these issues are actually happening. Once that license holder gets that information, a lot of times what will happen is then they will reach out to whoever is maintaining that facility and get these corrected immediately. So just it might be just a case of poor communication at that facility. So this will a lot of times take care of a lot of the issues that we're seeing. But when it doesn't, we move on to our next step. So the next step is our administrative hearing. So again, this is an informal hearing. So this is going to be just in front of our director of environmental health or his or her designee. And then it's not in front of our board. So coming out of this hearing, there's not going to be any formal reprimands or any kind of punishments that are coming out of this hearing. This is more just a, hey, now it's been a little bit too long of you guys not maintaining your pool where it needs to be. So you need to come in and tell us why that is. You give us face-to-face, tell us why you guys aren't doing what you're supposed to be doing, and give us a good reason of what we should do in regards to making sure that this is not going to happen again. It's going to get corrected. So again, we're sending out a letter, more documentation. Again, there's that, we don't want to trip over that speed bump going through this whole process. There's going to be that issue where it's going to get thrown out on a technicality. We don't want to hit that. So with that administrative hearing letter, again, that's being written by our program manager. With these, I do want to mention that all of these letters and all of these documents are being reviewed by at least the supervisor, if not the director or even our legal counsel, before these are sent out. So it's not something where the program manager is just writing everything up and then just mailing it out on their own. There is that checks and balances as it goes through, just to make sure that everything is correct in these letters. So the hearing letter is sent out. The hearing letter basically designates the reasons for the meeting, the issues, saying, hey, there have been documented uncorrected violations, critical and non-critical at your facility. Again, we're quoting the code. Okay, so we're referencing what code and what sections of code that we're enforcing. And then we're basically telling them you have to be here at our office at this time, date, and location. So we dictate the time and date. There are situations where the operator will try to reschedule that meeting. We are a little bit flexible on this, not very though. At this point in time of the enforcement procedure and our enforcement policy, obviously the operator's been blowing us off or ignoring our any kind of previous efforts we've had to get a hold of them or to get these issues corrected. So now it's time for them to kind of come on our terms. So we do set that time and date. We're pretty firm on that. Now, obviously, if they're coming from out of town and they can't get there for that day and they can only come another day, we will work with them on that. But it's going to be as close as possible to that time and date that we do set. So here in our office, the attendees are the director of environmental health, the supervisor of the program manager, and the inspector. So you have at least 4 people that are sitting there around the table saying, hey, these are the issues that we're seeing. For the facility, the letter does state that the license holder or their designee need to show up along with if they would like, their legal counsel. So I'd say about half the time they will bring a legal representative. A lot of times it'll just be themselves coming in with their tail between their legs saying, I'm sorry, I got to this point, it'll never happen again. With that, after or during the actual meeting itself or during the hearing, what we do is we lay out all of the documentation that we have. So we take that file that we've created and then we put it in front of that individual or that license holder or whoever it is that shows up and say, here, these are the issues that we're seeing at your pool. This is what we've done to try to get you guys to correct these issues. And here's how long it's been since you guys have ignored correcting them for us. Now, with this, we will get a lot of questions because a lot of times the license holder doesn't know the pool itself and the ins and outs of operating the pool. So we do get a lot of questions and do answer a lot of questions in regards to pool operation at this time. And we do a lot of education here as well. Like Ashley mentioned, the basis of everything that we do here is more education than enforcement. We try not to get to this policy, this part of our procedure, if we don't have to. We try to limit the amount of times that we use this just because we'd rather educate than enforce. So we're still doing that during this meeting as well. So we're trying to get everyone that's involved with this operation up to speed in regards to the Ohio Code and why it's important, not just that you have to do it, but why you have to do it, just to try to make it a little bit easier for them to understand where we're coming from as well. So after the meeting's over, we do send a summary letter that's sent out. The program manager, again, puts that together. Again, the program manager gets sick of writing letters through each one of these. But they do send out a letter just basically going over what was in that summary. But the main thing with this administrative hearing is we give them a final, basically, timeline to get this stuff done. So while during this hearing, for each one of the violations they're still present or that are recurring that happen on a regular basis, we work with that operator and say, here, this needs to be fixed by such and such date, or we're moving on to the next step. So again, there's going to be another reinspection that gets done. Usually it's done by, again, the inspector and the program manager or the supervisor if they're there, or if the program manager is not available. So we will go back out to these facilities to do another inspection after this to verify that these are done. Now, if we gave this presentation last year at this time, I would say that this is the farthest we've ever made in our enforcement policy, but we can't say that anymore. Because at the end of last year, we did move on, and we'll tell you guys, Ashley will actually fill you guys in about this a little bit later on here in the presentation. But we did move on to the next step in our policy, which is our license suspension or revocation. So this is our actual formal hearing. So if a facility then completely ignores our warning letters, our administrative hearing that we've had, and then all of those violations either are corrected or they're still recurring or whatever it might be, that's when we bring it to our board and say, hey, it's time to either suspend or revoke this license because they're just not following the code and they have no intention of doing so. So this is a formal hearing in front of our board. We do have a board of five residents of Cuyahoga County that are here. So the hearing is held with the board. So the letter, we send out an actual public hearing. You can see an example of it there with everything grayed out for the place that we did have under enforcement. So it lists the required attendees. So for our side, it is our board. So at least a quorum of our board members, our commissioner, our legal counsel, whoever was involved in this process from the environmental health side. So usually the director, the supervisor, the program manager, and the inspector. And then from the facility side, it lists that the license owner should show up along with their legal counsel, because this is technically a legal hearing. It's not held in front of a judge, but it is held in front of our board and is considered a legal hearing. So here in the state of Ohio, we do follow it. There is code, or excuse me, law that basically step-by-step instructions on how to do one of these. So we follow section 119 of the Ohio Revised Code. So like I said, until last year, at about this time, we could have said that, hey, we've never gone this far and we hope we never do. But unfortunately, that didn't happen. So I'll let Ashley take over from here.
All right, now that Tom's kind of given you guys some more information of our enforcement policy, I thought it was important to show some of our statistics for 2024. So we focus a lot on the Virginia Graham Baker Act and making sure that all pools are compliant. So for our outdoor pools, we had a couple of them. We have almost 400 outdoor pools, and we had 68 that did not provide information for us to make sure that they're compliant. So we sent out 68 letters. And you could see from right there, those warning letters are going directly to the license holder, that LLC, that owner. So they're getting that. And sometimes that's their first time in knowing that there's an issue because maybe the pool operator or the general manager isn't providing clear information to that. So you could see those 68 letters were sent, and we only had to have 3 hearings administratively in our office for that. And then there were 0 license or suspensions for that because they have decided to keep their pools closed for those 3 until they update their covers. And then we had 12 other various issues at facilities. So it had a multitude of issues of critical, non-critical, and reoccurring violations. And out of those 12, there were 3 administrative hearings and 1 license suspension or revocation. So you can truly see that when we send out these warning letters, it really explains to the operator, we mean that you have to fix it. We've given you several attempts to fix it and re-inspections. We're not seeing any improvement. So you can see that the warning letters really work, and having the administrative hearing also helps because we're able to speak with them directly. So I know everybody's really wondering how it leads up to the point of suspending and taking somebody's license away. And like Tom mentioned a couple times, this is something that we never had to do. Unfortunately, we had one bad apple around this time last year that we had to do this. So this just kind of is a timeline that shows you what was going on at this facility. So this time the inspector went out on January 5th, and they found some critical violations and some non-critical violations. And as we discussed at the beginning of our presentation, we have to go back out for follow-up inspections if a critical violation cannot be corrected before leaving. So you can see that the inspector did a couple consultations and some follow-ups there, went back out in March, and we still had criticals, and we had a couple more non-criticals. So the inspector discussed the issues. They said that they're corrected, needed some time, so went back out on May 1st. And so it is now May 1st. Our first inspection was in January, so almost 5 months later, we have 3 criticals and 9 non-criticals. So you could see that this place was progressively getting worse. So there was a warning letter that was sent. So that program manager reviewed the violations and sent out a warning letter to the owner. So as Tom said, we send that certified and in regular mail. And we went back out, we gave them about 2 weeks, went back out, and there are now 3 critical violations and more, 11 non-critical violations. So at this time, obviously they were not correcting anything. There were more violations that were occurring because they were just blatantly not maintaining. This is a spa, by the way, too. They were just not maintaining it. So due to this, we ended up having an administrative hearing. So we had to send that letter out notifying them of the administrative hearing, and that was scheduled for June 18th. So at that time, there's a discussion. It was just the general manager. And to give you guys a little more background about this location, this was a spa located inside of a fitness center. So obviously their main business school is the fitness center itself, and the spa to them was just a small asset that they had. So that's why they didn't see the real importance of making these corrections. So we met with the general manager, and at that time of our meeting, we discussed that spa should remain closed until there was training, the critical violations were corrected, and the non-critical violations were corrected too. So that was in June. And you can see from the timeline, we went back out. Our inspector went out on June 25th, July 8th, and July 31st. And at that time, the spa was closed and drained. Now, in mid-August, the inspector that normally goes out had retired. So I myself went out on August 27th, where miraculously water was back into the spa. At that time, there were 7 critical violations and there were 20 non-critical violations. So now we're at 27 documenting violations. And in January, we started only at 7. So you could see that they just did not care at this point. And we're extremely concerned, and we're speaking with our legal counsel, I would say on a weekly basis, about what was going on, even daily. So the general manager had contacted me to go over this. So I spoke to him on the phone. He said that the pool was not in, the spa was not in operation. It was not in use at that time. However, their employees that were there said it was open for the public. So we stopped back out a couple times, and they said that it was closed and the spa was filled. So at this time, we were kind of just babysitting, giving them, if we take anything to our board, we want to make sure that we have all the documents, we've made all the attempts for them to correct things. So that's why we did a lot of follow-ups to make sure that we are documenting that we were trying to work with them, and they just blatantly didn't care. So on the 24th, when we went, we were unable to find an employee there. This is a 4-story fitness center. And we couldn't find one employee. A patron had left me in, and the spa was filled again, even though they said it was closed. So that was September 24th. I spoke with our legal counsel, and they told me to go back out. So I went back out for a follow-up on October 3rd. Still on October 3rd, our inspection, there were several critical findings, and this just kind of gives you a general idea of what was there. We had 0 disinfection, the circulation system was off, the automatic chemical controller was in alarm mode, and the safety vacuum release system and the automatic chemical controller is supposed to be tested monthly and still was not being tested. And then you can see on here, there's a slew of non-critical violations. So our staff was not knowledgeable. There were several issues with record keeping and documenting items. They weren't documenting when they were putting chemicals directly into the water. There was not a weir there. Their skimmer basket was undersized. There was tiles. The sand filter was an issue for a long time that was not properly sized. And a lot of chemistry issues, and the emergency valve was not working. And I do want to say that our test reagents that we did find too were from 2022 and 2023. So they had no test reagents that were there. So this last portion just kind of goes over some pictures for you to get a better idea of what we were dealing with. So this is again in a fitness center. You could see here in the picture, the spas in the back, and this was the area for the hot tub and the sauna. And there was no way to really block it off because the perimeter barrier that the state says are those doors that the patrons access when getting into the gym. So there was no barrier to kind of lock it up. The general manager and employees mentioned several times during our visits that they could put the sign there and say that it's closed, but the patrons should just move it right over and go back in. Go ahead to the next slide. So that just kind of gives you a better idea of the spa. You could fit quite a few people in there. And unfortunately, with the spa, you could see that it's clear. And that's like the scary thing almost. There's zero disinfection in there, but it's clear, so you think it's safe. And this just shows you that the automatic chemical controller was found in alarm mode. The circulation system was found shut off. So, you know, who really knows what was going on in that water? I didn't really enjoy putting my hand to test it. And it just shows you your reagents. So you want to make sure that you're following what your manufacturer states for your test reagents. If they say that there's an expiration, then you have to go by that expiration in that picture. You could see here, this was something odd with the skimmer basket. You could see clearly here, it was not sized properly, and it wasn't collecting all the materials to protect it from going to the pump. So since that October 3rd visit, there were signed proposed orders that were mailed by our legal counsel. And that was just basically stating that they were on notice that this was going to be a part of our board agenda, and that we were looking at suspending their license. So when we got that, the general manager contacted us on November 18th, 2 days before the scheduled hearing, and said that the spa has remained closed, that they were working on getting training. They were working with a company to have these corrections made. So at that time, we spoke with our legal counsel. They agreed, let's table it until the next month, see if they make any corrections. And December 18th came, and nobody even showed up. Nobody contacted us. So we presented our case to the board, and our board members were horrified that one, they couldn't show up, that they didn't see the importance of training their staff, and really they were putting their patrons at risk of some sort of injury or illness. So due to the board meeting and presenting it, our board did vote, all 5 of them, to suspend the license at the facility. So the orders were sent, and there was a consultation on January 6th, kind of saying like, what can we do to correct that? So we went out there and stickered them closed and let them know that they were unable to operate. And unfortunately, when we went out there, there was still water in the spa, and they were told in the orders specifically that the spa needed to be drained. Because again, if you remember those pictures, there was no barrier that they could prevent their patrons from going into the spa. So it was decided on by our legal counsel and by our board that they wanted that spa to be drained. So due to them not being compliant with that, we had to file a temporary restraining order with our county courts, and it was signed and provided to them. We were actually, when we presented this at AOP in February, it was the week after we got back, we were actually supposed to go to court. And what ended up happening is that they agreed for a judgment consent, and there is now a permanent restraining order on the spa. So the spa is no longer operating. We do send an inspector out probably routinely every month just to check up to make sure that that spa is still drained, and we have not heard from them.
So long story short, our enforcement actions do work. 99% of the time we don't, 99.9% of the time we don't get to that point where we have to revoke someone or suspend someone's license, but we can if it does. That's the last thing that we want to do. We obviously don't want to take away people's livelihoods or people's enjoyment of using pools and spas, but we will use every avenue that we have to make sure that people can use it safely and that no one's going to get sick or hurt with something that we didn't do or something that we could have done a little bit better. So at this time, we'll feel free to ask any questions you guys might have.
Yeah, thank you, Tom. Thank you, Ashley. So we do have a couple of questions that came in. The first is asking if you have a written SOP on your pool enforcement procedure.
Yes, so
Yeah.
we actually have the policy written, and we don't have a specific SOP on how to create the policies or anything like that, but we do have the policy itself, yes, which is written out completely and is signed by our director every time it's updated.
Okay. Is that something you're able to share?
Absolutely, yeah. So we can definitely get
cool.
it to Dewey and Susan, and they can send it out to everyone that's here.
Yeah, that'd be great. I'm sure several would like to see that.
For sure.
We have another question referring to your critical violations, right? How many of those were repeat violations?
I can't remember off the top of my head how many were repeat. I do know disinfection was certainly one that we would go several times. The SPAL has to be at 2 parts per million, and we found it several times at 0. The automatic chemical controller was in alarm mode several times. The circulation system was found off. I think that was only one time that we found that shut off, but also not recording and testing that the automatic chemical controller and the safety vacuum release system is working. Those were also repeats. So several repeat criticals there.
Yeah, and as far as overall for those slides that we showed with some of our violation info for our jurisdiction overall, we don't have those numbers specifically, but that is definitely something that we can pull out of our system. Whenever we do our operator training, we do include those violation slides, and we put a little bit more information into them in regards to here. These are our repeat critical violations. These are our repeat non-critical violations, and we definitely show our operators that here, this is what we're seeing. And we want to really focus on that when we're doing our training. So we don't have those numbers specifically right now, but we can definitely get that very easily to you guys.
Great. Thank you, Tom. Thank you, Ashley. So before I ask the last question in the chat, just a reminder, if you have questions, please pop those in chat, and then I'll pass those along to Tom and Ashley. Also, make sure you do a screenshot to capture their contact information. I've known Tom and Ashley for a few years now, and one thing that they're very noted for is, in addition to being exceptionally knowledgeable, is also being passionate and caring about public health. And I know they would love to engage and help and answer questions and be a resource for y'all. So continuing on the questions, right? What would the process be for a pool that had their license revoked to reestablish a license?
So for this one specifically, we stated that they had to have training. So that was the requirement. Somebody needed to have certified a pool operator training, or they needed to have a pool company come in and state and outline the training that they had. And they had to also correct all the critical violations, correct all the non-critical violations before they were allowed to operate. This is something that our board was very adamant about. And they basically stated that if they were found not operating, that we would close them again, because we weren't going to go back and start the process all over again.
Yeah, with that specific facility, the license was suspended and not revoked. So it made it a little bit easier for that operation to get their license back if they do end up doing what Ashley just mentioned. If the board would have decided to revoke their license, basically pull it away and it's null and void, they would have to start over. So they would have to go through the whole plan review process and start from the very beginning and bring everything up to code, whatever the current code is. So it just depends on what our board decided to do. But for this one, they decided on suspending instead of revocation.
We'll give just another 20 seconds or so for any additional questions to come in. So one question that came in just now, I thought you heard right from the poster mention that you do not have authority to close a pool even temporarily. If you have an outbreak, does that allow you to close?
No, unfortunately not. It's one of those critical violations that Ashley mentioned that it actually specifically states in the violation that if you cause an outbreak or have some sort of communicable disease that has been spread through your body of water, you shall not be operating. So it's all the onus is on the operator. We don't have the authority to do it. Now, that being said, if there is some sort of immediate danger to public health, there's power lines that are laying next to the pool and the pool doesn't want to close, we can reach out to our board and our health commissioner and have an order signed, an immediate order signed to close them. So basically we supersede our enforcement policy, and because there's that immediate danger to public health, and we can order them closed that way. We very rarely do that. We do it more often in our food program than our pools program.
Yeah. So there is a mechanism, just not direct ability.
Correct. Yeah, and it is
Mm-hmm.
very rare that we use that, because again, it has to be one of those extreme dangers to extreme immediate danger to public health.
Yep.
Yeah. Dewey, I would like to add that for those operators, when we're at the inspection, there's critical violations. For the most part, we tell them, like, we recommend you to close until these are corrected. And I would say 98, 99% of the time, they go ahead and close because they don't want to be liable if someone gets hurt or sick. It's just unfortunately that 1% that sometimes is just like, we're going to stay open. And then that's when our sanitarians come back and discuss it with the program manager and the supervisor to figure out what we can do.
Yeah. That tracks in my experience too, right? We don't see that many bad actors that really just don't want to do the right thing. A majority of operators and facilities, they do care. They do want to do the right thing. So that tracks with what I've seen. So, yeah. The follow-up question, are you able at any time to issue fines for non-compliance?
Nope. In our code, it doesn't say anything specifically about fines or closure at all. So here in the state of Ohio, we don't issue letter grades for any of our programs that we work in, whether it be pools, food, whatever it might be. We don't issue letter grades. We don't issue fines. The only thing we do is issue violations. So that's all we're able to do. So we hold their licenses above their heads is what is really our enforcement powers.
Yeah. That's probably a more meaningful approach anyway than a random number assignment, a random letter assignment.
Yep. Yeah.
Yeah.
I think so.
Yeah. Awesome. Okay. Well, we're close to the hour. Tom, Ashley, I want to thank you for carving some time out of your day to be here with us and share your knowledge, expertise, and experiences. I want to thank everyone else for attending today for this webinar and encourage you to be on the lookout for our July webinar, where another CMAHC ambassador, Miklos Valdez, will look at midsummer pool problems from an operator perspective. So flipping the switch there a little bit. That's always an interesting topic, an interesting approach. So again, Tom, Ashley, thank you very much. Attendees, thank you very much. I hope all have a good opening season. And to all of our public health officials, I share this frequently in our state designee meetings that we have with our state leads, but I want to share it with y'all. Thank you for the work you do. You are truly unsung heroes, and the efforts you do on a regular basis are that barrier that protects us from being much sicker and much less safe. So I always want to make a point to say thank you, health officials, for the work you do. With that being said, we'll conclude the webinar. Thanks again, everyone. Y'all have a great opening pool season. We'll see you in July.
Thanks, Tom and Ashley. Appreciate you both.
Thanks,
Thank you, guys. Appreciate you guys having us.
Thank you, guys.
Yeah, thanks.
Yeah.